Question 1. A 68-year-old male with a history of type 2 diabetes mellitus presents with diabetic polyneuropathy affecting both lower extremities. He also has uncontrolled hypertension. Which of the following is the correct ICD-10 CM coding for this encounter? I. G63, E11, 40, I10. B. E11, 42, G99, 0, I10. C. E11, 42, I10. D. E11, 42, G63, I10. Answer B. E11, 42, G99, 0, I10. This question tests your knowledge of sequencing codes for diabetes with complications, specifically the use additional code and code first notes. The primary diagnosis is type 2 diabetes mellitus with polyneuropathy, which is captured by the combination code E1142. The polyneuropathy itself is a manifestation of the diabetes, and ICD-10 CM guidelines require an additional code from category G99, 0, diabetic polyneuropathy, to specify the type of neuropathy, even though E1142 already implies it. Finally, the uncontrolled hypertension is coded as I10. Remember to always follow instructional notes like use additional code to capture the full clinical picture. Question 2. A 45-year-old patient fell from a ladder 3 weeks ago, resulting in a closed transverse fracture of the shaft of the left femur. The patient is now seen in the clinic for routine follow-up care, and the fracture is healing well. Which of the following is the correct ICD-10 CM coding for this encounter? I. S72, 322A, W11, XXXA, Y92, 012. B. S72, 322D, W11, XXXD, Y92, 012. C. S72, 322S, W11, XXXS, Y92, 012. D. S72, 322D. Answer D. S72, 322D. This question focuses on correct coding for a subsequent encounter for a fracture, including laterality and the appropriate seventh character. The fracture of the shaft of the left femur is coded with S72, 322. Since this is a follow-up visit 3 weeks after the initial injury, and the fracture is healing, the seventh character D for a subsequent encounter for fracture with routine healing is appropriate. External cause codes, W11, XXD, and place-of-occurrence codes, Y92, 012, are typically only required for the initial encounter to describe how and where the injury occurred, not for subsequent follow-up visits. Always be mindful of the initial versus subsequent encounter definition when applying seventh characters and additional external cause codes. Question 3. A patient is admitted to the emergency department experiencing severe nausea and vomiting after accidentally taking a double dose of their prescribed pain medication, hydrocodone. The physician documents accidental hydrocodone overdose. What is the correct ICD-10 CM coding? I. T40 2X1A R11 2F11 129. B. T40 2X2A R11 2. C. T40 2X3A R11 2. D. T40 2X4A R11 2. Answer B. T40 2X2A R11 2. This question tests the distinction between poisoning, accidental overdose, and adverse effects, specifically focusing on accidental poisoning. The key phrase, accidentally taking a double dose, indicates a poisoning, specifically accidental. For an accidental poisoning by an opioid like hydrocodone, you would use T40 2X2, where 2 signifies accidental, unintentional poisoning. The appropriate seventh character for the initial encounter is A. The symptoms of nausea and vomiting are coded separately as R11, 2. Remember that poisoning refers to an overdose, wrong substance, or wrong dose taken by mistake, while adverse effect is a side effect of a correctly administered drug. Question 4. A 72-year-old male is admitted for treatment of metastatic bone cancer. The primary cancer was previously resected from the prostate 5 years ago, and there is no current evidence of prostate cancer recurrence. What is the correct ICD-10 CM coding? I. C79, 51, C61. B. C79, 51, Z85, 46. C. C61, C79, 51. D. C79, 51. Answer B. C79, 51, Z85, 46. This question tests the coding guidelines for metastatic cancer when the primary site has been successfully treated and is no longer present. The key here is primary cancer was previously resected, no current evidence of prostate cancer recurrence. When the patient has metastatic cancer from a primary site that has been removed, and there is no mention of recurrence of the primary, the metastatic site, bone, C79, 51, is coded as the principal diagnosis. A history of the primary malignancy, Z85, 46 for personal history of malignant neoplasm of prostate, should also be reported to provide the complete clinical picture. You do not code the primary malignancy as active, C61, if it has been removed and is not currently recurring. Question 5. A 55-year-old patient with pneumonia develops severe sepsis with acute kidney failure. The physician documents severe sepsis due to pneumonia with acute kidney failure. What is the correct ICD-10 CM coding? I. R65, 20, J18, 9 and 17, 9. B. A 41, 9, J18, 9 and 17, 9 R65, 20. C. J18, 9 R65, 20 and 17, 9. D. R65, 20 and 17, 9, J18, 9. Answer C. J18, 9 R65, 20 and 17, 9. This question assesses your understanding of sequencing codes for severe sepsis. When sepsis is documented due to an infection, the underlying systemic infection, pneumonia, J18, 9, should be coded first. Next, an additional code for the severe sepsis, R65-20, is required to indicate its severity, as R65-20 is specifically for severe sepsis without septic shock. Finally, the acute kidney failure, N17-9, is coded to identify the associated organ dysfunction. Remember the general rule: infection first, then sepsis/severe sepsis, then associated organ dysfunction. Question 6. A 32-year-old pregnant patient, 28 weeks gestation, is HIV positive and is admitted for routine prenatal care. The medical record clearly indicates she is HIV positive. What is the correct ICD-10 CM coding? I. Z34 02 098 712 B20. B. 098 712 B20 Z34 02. C. 098 712 Z21 Z34 02. D. Z34 02 Z21. Answer B. 098 712 B20 Z34 02. This question tests the specific sequencing guidelines for HIV in pregnancy. When a pregnant patient is HIV positive, the HIV infection is always considered a complicating factor of the pregnancy. Therefore, the code for the pregnancy with HIV 098-7 must be sequenced first. Since the patient is HIV positive and not just asymptomatic, B20 HIV disease is coded next, followed by the specific encounter code for routine prenatal care, Z3402 for routine prenatal care, second trimester. Always remember that 098-7 takes precedence over B20 or Z21 when HIV is present during pregnancy. Question 7. A patient undergoes an outpatient colonoscopy. 2 days later, the patient returns to the emergency department with severe abdominal pain and a fever, and a perforation of the colon is diagnosed, directly attributed to the recent colonoscopy. What is the correct ICD-10 CM coding? I. K63 1 T81 2XXA. B. T81 2XXA K63 1. C. K63 1. Y62 0 R10 0 R50 9. D. K63 1 Y69. Answer B. T81 2XXA K63 1. This question tests the coding of complications of medical care. The key here is that the colon perforation is directly attributed to the colonoscopy. When a complication of a medical procedure occurs, the complication code, T81 2XXA for accidental puncture or laceration during a procedure, initial encounter, is sequenced first. The specific nature of the complication, in this case, colon perforation, K63 1, is coded second. Remember to use the appropriate T-code for complications of procedures and then specify the anatomical site affected. Question 8. A 50-year-old male presents for a routine colon cancer screening. The physician performs the screening colonoscopy and finds no abnormalities. What is the correct ICD-10-CM coding? I. Z12-11. B. Z12-11. Z86-010. C. K63-9. D. Z0000. Z12-11. Answer I. Z12-11. This question tests the appropriate use of Z codes for screenings. The key phrase routine colon cancer screening indicates the primary reason for the encounter. When the purpose of the encounter is purely for screening and no abnormalities are found, the screening code, Z12-11 for encounter for screening for malignant neoplasm of colon, is the principal diagnosis. You would not use codes for specific conditions, K63-9, or general medical examination codes, Z0000, as the primary reason for a screening encounter. Question 9. A patient with benign essential hypertension is admitted with congestive heart failure, CHF, and acute renal failure. The physician documents hypertension with CHF and acute renal failure. What is the correct ICD-10-CM coding? I11 0 I50 9 and 17 9. B. I13 0 I50 9 and 17 9. C. I10 I50 9 and 17 9. D. I13 2 I50 9 and 17 9. Answer B. I13 0 I50 9 and 17 9. This question tests the use of combination codes for hypertension affecting the heart and kidneys. When hypertension is complicated by both heart and renal conditions, and a single combination code exists to capture both, that code should be used. In this case, I13-0 represents hypertensive heart and chronic kidney disease, with heart failure in stage 1 to 4 chronic kidney disease. Although acute renal failure is also present, and 17-9, I13-0 explicitly links the hypertension to the heart failure. The I13-0 code implies the stage of CKD is not specified as severe. Therefore, for hypertension with both heart failure and kidney involvement, I13-0 is appropriate, followed by I59 for the specific type of heart failure and N17-9 for the acute renal failure. If the question specified chronic kidney disease, a more specific I13-10, I13-11 would be used with the CKD stage. However, I13-0 is the best fit for combined heart and renal involvement. Question 10. A 5-year-old child is brought to the emergency department after falling from playground equipment at school. The child sustained a laceration to the forehead. Which of the following is the correct ICD-10-CM coding sequence? I. S01 81XA, W09 0XXA, Y92 210. B. W09 0XXA, S01 81XA, Y92 210. C. S01 81XA, Y92 210. D. S01 81XA, W09 0XXA, Y92 9. Answer I. S01 81XA, W090XXA Y92 210. This question tests the proper sequencing of external cause codes and place of occurrence codes with an injury. The primary diagnosis is the injury itself, laceration of forehead, S0181XA with A for initial encounter. Following the injury code, an external cause code is reported to describe the circumstances of the injury, W090XXA for fall from playground equipment. Finally, a place of occurrence code, Y92 210 for school, primary or secondary, is added to specify where the event happened. Remember, external cause codes are supplemental and are never sequenced as the primary diagnosis. Question 11. A 60-year-old patient presents with chronic, intractable low back pain due to degenerative disc disease. What is the correct ICD-10-CM coding? I. M54 5 G89 21 B. G89 21 M54 5 C. M54 5 G89 4 D. G89 4 M54 5. Answer B. G89 21 M54 5. This question focuses on the specific sequencing guidelines for chronic pain, especially when the underlying cause is known. When chronic pain is documented as intractable, a code from category G89 to chronic pain, intractable, is assigned. The guideline states that if the pain is chronic and intractable, the G89-2 code should be sequenced first, followed by the code for the underlying condition causing the pain. Therefore, G89-21 chronic intractable low back pain is primary, followed by M54-5 low back pain due to degenerative disc disease. If the pain was not intractable, M54-5 would be coded alone. Question 12. A 30-year-old pregnant patient, 32 weeks gestation, presents with severe preeclampsia. What is the correct ICD-10-CM coding? I. O14-12 B. O14-10 C. O14-13 D. O14-93. Answer C. O14-13. This question tests the correct coding for preeclampsia during pregnancy, specifically requiring the appropriate trimester designation. Severe preeclampsia is coded as O14-1. Since the patient is 32 weeks gestation, this falls into the third trimester, 28 weeks 0 days to delivery. Therefore, the correct code is O14-13. Always pay close attention to the trimester documentation when coding conditions related to pregnancy. Question 13. A patient is admitted to the burn unit with full-thickness burns to 15% of their total body surface area, TBSA, on the trunk, and second-degree burns to 9% of their TBSA on the right arm. What is the correct ICD-10-CM coding? I. T21-30XA, T22-211A, T31-20. B. T21-30XA, T22-211A, T31-11. C. T21-30XA, T22-211A, T31-21. D. T31-21, T21-30XA, T22-211A. Answer C. T21-30XA, T22-211A, T31-21. This question requires proper sequencing and selection of burn codes for multiple sites and degrees, along with the TBSA code. The most severe burn, full thickness, is sequenced first for the trunk, T21-30A. Then, the second-degree burn to the right arm, T22-211I, is coded. Finally, a code from category T31 or T32 is used to report the percentage of total body surface area and the percentage of third-degree burns. In this case, 15% full thickness, third degree, and 9% second degree totals 24% TBSA with 15% third degree, which corresponds to T31-21. Remember to always code each burn site and degree, and then include the TBSA code as an additional diagnosis. Question 14. A patient is diagnosed with primary open-angle glaucoma, moderate stage, in both eyes. What is the correct ICD-10-CM coding? I. H40-10X2. B. H40-11X2. C. H40-1132. D. H40-1192. Answer C. H40-1132. This question tests your ability to select specific codes for glaucoma, including laterality and stage. Primary open-angle glaucoma is coded with H40-11. The patient has both eyes affected, which corresponds to the third character, 3. The stage is moderate, which corresponds to the fifth character, 2. Therefore, H40-1132 is the correct code. Pay close attention to all available characters in the ICD-10-CM tabular list to ensure maximum specificity, especially for conditions like glaucoma that require laterality and staging. Question 15. A 40-year-old male with a history of asthma presents to the emergency department in acute respiratory distress and is diagnosed with status asthmaticus. What is the correct ICD-10-CM coding? I. J45-901. B. J45-909. C. J45-902. D. J45-90. Answer I. J45-901. This question tests the specific coding for asthma when it presents as status asthmaticus. Status asthmaticus is a severe, prolonged asthma attack that does not respond to usual treatment. For unspecified asthma with status asthmaticus, the correct code is J45-901. It is critical to select the most specific code available that reflects the clinical severity, as status asthmaticus significantly impacts patient care and resource utilization. Never use an unspecified code like J45-909 if a more specific option exists. Question 16. A 70-year-old patient with end-stage renal disease, ESRD, and anemia is admitted for dialysis. The anemia is documented as being due to the ESRD. What is the correct ICD-10-CM coding? I12-0-N18-6, D63-8. B. N18-6, D63-8. C. N18-6, D63-1. D. N18-6, D63-8, Z99-2. Answer D. N18-6, D63-8, Z99-2. This question tests the coding of anemia associated with chronic kidney disease, CKD, and ESRD, along with the encounter for dialysis. The principal diagnosis is end-stage renal disease, ESRD, coded as N18-6. Anemia due to CKD is a common and important manifestation, and the specific code D63-8, anemia and other chronic diseases classified elsewhere, is used as an additional diagnosis, following the note under N18-6. Finally, for patients on dialysis, AZ code for dependence on renal dialysis, Z99-2, is also required to provide a complete picture of the patient's condition and care needs. Remember to follow code first and use additional code instructions. Question 17. A patient presents to the emergency department after a motor vehicle accident with a closed fracture of the right tibia shaft and a contusion of the left shoulder. What is the correct ICD-10-CM coding for this initial encounter? I. S82-221A, S40-022A, B43-62XA. B. S82-221A, S40-022A, B49-9XXA. C. S82-221A, S40-022A. D. B43-62XA, S82-221A, S40-022A. Answer I. S82-221A, S40-022A, B43-62XA. This question tests the coding of multiple injuries from a single event, including external cause codes. When a patient sustains multiple injuries, each injury is coded separately. The closed fracture of the right tibia shaft is coded as S82-221A, initial encounter. The contusion of the left shoulder is coded as S40-022A, initial encounter. Since this is a motor vehicle accident, an external cause code for the accident, V43-62XA for car passenger injured in collision with car, initial encounter, should also be reported to describe the circumstances. Remember to code each injury individually and include external cause codes for the initial encounter. Question 18. A patient is admitted to the hospital for the administration of chemotherapy for metastatic colon cancer to the liver. What is the correct ICD-10-CM coding? I. C78-7, C18-9, Z51-11. B. Z51-11, C78-7, C18-9. C. C18-9, C78-7, Z51-11. D. Z51-11, C18-9, C78-7. Answer B. Z51-11, C78-7, C18-9. This question tests the sequencing of codes when a patient is admitted primarily for chemotherapy. When the primary reason for the encounter is chemotherapy, the Z code for encounter for antineoplastic chemotherapy, Z51-11, is always sequenced first. The malignant neoplasm S, for which the chemotherapy is being administered, are then coded as secondary diagnoses. In this case, the metastatic liver cancer, C78-7, is coded, followed by the primary colon cancer, C18-9. Always remember that Z51-11 takes precedence as the principal diagnosis when the focus of the visit is chemotherapy. Question 19. A patient is admitted with a urinary tract infection, UTI, due to methicillin-resistant Staphylococcus aureus, MRSA. What is the correct ICD-10-CM coding? I. N39-0, A49-02. B. A49-02, N39-0. C. N39-0, B95-62. D. B95-62, N39-0. Answer I. N39-0, A49-02. This question tests the proper coding for infections caused by MRSA. When an infection, like a UTI N39-0, is caused by MRSA, the infection itself is coded first. An additional code for the MRSA infection, A49-02, methicillin-resistant Staphylococcus aureus infection, unspecified site, is then used to identify the causative organism. The use of B95-62 is incorrect here because B95 codes are for bacterial agents in diseases classified elsewhere, not for active, current infections specified as MRSA. Remember to code the definitive infection first, then the specific resistant organism. Question 20. A 75-year-old patient with sacral pressure ulcer, stage 3, is admitted for debridement. What is the correct ICD-10-CM coding? I. L89-153. B. L89-150. C. L89-153 I96. D. L89-159. Answer I. L89-153. This question tests the specific coding for pressure ulcers, including the site and stage. The patient has a sacral pressure ulcer, stage 3. The code for sacral pressure ulcer is L89-15, and the specific stage 3 is indicated by the fourth digit 3. Therefore, L89-153 is the correct code. Always ensure you are coding to the highest level of specificity provided in the documentation, including the anatomical site and the specific stage of the pressure ulcer. Question 21. A patient with myelodysplastic syndrome, MDS, develops severe anemia due to the MDS. The physician documents anemia secondary to myelodysplastic syndrome. What is the correct ICD-10-CM coding? I. D64, 9. D46, 9. B. D46, 9. D64, 9. C. D46, 9. D63, 8. D. D63, 8. D46, 9. Answer C. D46, 9. D63, 8. This question tests the coding of anemia associated with another chronic condition, specifically when the anemia is a manifestation. Myelodysplastic syndrome, MDS, is the underlying disease, which is coded as D46, 9. Anemia is a common manifestation of MDS. When the anemia is due to another chronic condition, an additional code from D63, 8, anemia and other chronic diseases classified elsewhere, is used. The underlying condition, MDS, is sequenced first, followed by the anemia. Remember, for conditions where anemia is a manifestation of an underlying chronic disease, the underlying condition takes precedence. Question 22. A patient is seen for aftercare following a total hip replacement performed 2 months ago. There are no complications, and the patient is recovering well. What is the correct ICD-10-CM coding? I. Z47, 1. Z96, 641. B. Z47, 1. C. Z96, 641. D. Z47, 1. T84, 9 XXS. Answer I. Z47, 1. Z96, 641. This question tests the use of Z codes for aftercare and for the presence of orthopedic prostheses. The primary reason for the encounter is aftercare following joint replacement surgery, which is coded as Z47, 1. Since the patient has a total hip replacement, it is important to also report the presence of the orthopedic implant. Therefore, Z96, 641, presence of right artificial hip joint, should be coded as an additional diagnosis to fully describe the patient's status. Always consider additional Z codes that provide context to the patient's condition, such as the presence of implants. Question 23. A 6-month-old infant is admitted for observation after accidental ingestion of a non-toxic household cleaning product. After 24 hours of observation, the infant shows no ill effects and is discharged. What is the correct ICD-10-CM coding? I. Z03, 79. B. T49, 9XXA, Z03, 79. C. Z03, 6. D. R69, Z03, 6. Answer I. Z03, 79. This question tests the use of observation codes when no injury or poisoning actually occurs. The key information is accidental ingestion of a non-toxic household cleaning product and shows no ill effects. When a patient is admitted for observation due to suspected exposure to a toxic substance, but no signs, symptoms, or definitive poisoning are found, the appropriate code is Z0379, encounter for observation for other suspected diseases and conditions ruled out. This code indicates that the observation led to ruling out any adverse effects from the ingestion. Question 24. A 78-year-old patient is diagnosed with dementia due to Parkinson's disease. The physician notes the dementia is with behavioral disturbance. What is the correct ICD-10-CM coding? I. G20 F02 80. B. G20 F02 81. C. F02 81 G20. D. F02 80 G20. Answer C. F02 81 G20. This question tests the sequencing of dementia due to another medical condition, especially when behavioral disturbances are present. For dementia due to an underlying neurological condition like Parkinson's disease, the mental health condition, dementia, is sequenced first, followed by the neurological disorder. The code for dementia and other diseases classified elsewhere with behavioral disturbance is F0281. This is followed by G20 for Parkinson's disease. Remember, when a neurological condition causes dementia, the dementia code is usually primary. Question 25. A 40-year-old patient presents with a severe headache. After examination and workup, the physician documents headache, likely migraine, unspecified type. What is the correct ICD-10-CM coding? I. G43-909. B. G43-901. C. R51. D. G44-209. Answer I. G43-909. This question tests the proper use of unspecified codes for conditions where more specific information is not available or documented. The physician documents headache, likely migraine, unspecified type. When a specific type of migraine is not documented, a G without aura with aura, the unspecified migraine code is appropriate. G43-909 represents migraine, unspecified, not intractable, without status migrainosus. R51 is for headache, which is too general if migraine is suspected. Always choose the most specific code available that accurately reflects the documented diagnosis, even if it is an unspecified variant of a more specific condition. Question 26. A patient with chronic obstructive pulmonary disease, COD, is admitted with an acute exacerbation of their COPD and acute bronchitis. What is the correct ICD-10-CM coding? I. J44-0, J29. B. J44-1, J29. C. J44-1. D. J29, J44-1. Answer C. J44-1. This question tests the use of combination codes for acute exacerbations of chronic conditions. The documentation states acute exacerbation of their COPD and acute bronchitis. When a patient has COPD with an acute exacerbation and acute bronchitis is also present, ICD-10-CM guidelines direct you to use the single combination code J44-1, chronic obstructive pulmonary disease with acute exacerbation. This code implicitly includes the acute bronchitis, as it is considered part of the exacerbation. Avoid coding acute bronchitis separately when it's documented as part of a COPD exacerbation. Question 27. A patient presents to the orthopedic clinic with nonunion of a previously fractured left ankle. The fracture occurred 8 months ago. What is the correct ICD-10-CM coding? I. S82-892A. B. S82-892S. C. S82-892K. D. S82-892P. Answer D. S82-892P. This question tests the understanding of seventh characters for fractures, specifically for nonunion. The patient has a nonunion of a previously fractured left ankle. Nonunion implies that the fracture has failed to heal properly. The appropriate seventh character for nonunion for a fracture of the ankle is P. Therefore, the correct code would be S82-892P. Remember that the seventh character P specifically identifies a subsequent encounter for a fracture with nonunion, indicating a significant complication in the healing process. Question 28. A patient is admitted with malignant ascites secondary to metastatic ovarian cancer. The metastatic ovarian cancer is documented as the current active disease. What is the correct ICD-10-CM coding? I. C78-6. C56-9. B. R18-8. C56-9. C78-6. C. C56-9. C78-6. R18-8. D. R18-8. C56-9. Answer C. C56-9. C78-6. R18-8. This question tests the sequencing of codes for malignant ascites as a manifestation of active metastatic cancer. The principal diagnosis is the active primary malignant neoplasm, which is the ovarian cancer, C56 9. The metastatic site, liver, C78-6, assuming it's specified as the site of metastasis causing the ascites or generally indicating widespread metastasis causing ascites, is then coded. Finally, the malignant ascites itself, R18-8, is coded as a manifestation. While ascites is a symptom, when it's specifically documented as malignant ascites and linked to cancer, it should be coded as an additional diagnosis following the cancer codes. It is a specific manifestation. Question 29. A patient is admitted with pneumonia and tests positive for COVID-19. The physician documents COVID-19 pneumonia. What is the correct ICD-10-CM coding? I. J12 89U071. B. U071 J12 89. C. U071 J18 9. D. J12 89. Answer B. U071 J12 89. This question tests the specific guidelines for coding COVID-19 with respiratory manifestations. When COVID-19 is confirmed and a respiratory manifestation such as pneumonia is present and documented as COVID-19 pneumonia, the code U071 COVID-19 is sequenced first. An additional code for the specific pneumonia, J1289, other viral pneumonia, is then reported to describe the manifestation. Always prioritize U071 when COVID-19 is confirmed and associated with a manifestation. Question 30. A patient presents for a routine physical exam. During the exam, the patient mentions a history of previous colon polyps that were fully removed 5 years ago, with no recurrence since. What is the correct ICD-10-CM coding for this encounter? I. Z0000, Z8711. B. Z0000, C. Z8711. D. Z0000, K63, 5. Answer I. Z0000, Z8711. This question tests the appropriate use of Z codes for routine examinations and personal history. The primary reason for the encounter is a routine physical exam, which is coded as Z0000. The patient's history of previous colon polyps that were fully removed should be captured using a personal history code. Z8711, personal history of colonic polyps, is the correct code for this. Remember to include relevant personal history codes with routine exams to provide a complete and accurate picture of the patient's past medical conditions.